Good afternoon. Thank you for joining us for National Hospice Month, all month long in November. I'm Jessica McCune. I work on the team here at Hospice of Marion County. I'm a nurse and a licensed mental health counselor, but right now serving in community awareness and community education. We have created a caregiver panel. It is at the core of our work here at Hospice of Marion County. On our panel, you will meet Dr. Mary Lasada, our Chief Medical Officer, who truly needs no introduction. But she is also a professional, but an advocate for families in the community as well as our clients. She also manages our physician team. She is also board certified in hospice and palliative care, neurology, and psychiatry. I want you to know that she's a fellow in the American Academy of Hospice and Palliative Care and a fellow with the American Psychiatry Association. I look forward to you joining us with Dr. Lasada. You will also meet Senator Dennis Baxley. He has been a leader almost all of his adult life, and some may not know that he was on the Bellevue City Council and the mayor of Bellevue before he began going to Tallahassee to serve us in the 12th District. He started as a state representative for us in 2000 and served till 2007, took a couple of years off, and back in 2010 through 2016, he again served us as our representative for Marion County, and since 2016 has been serving us in the Senate. He is well known to caregiving. He is known to be an advocate for foster children. You will also get to meet David Companion. He is one of our very own, a nurse practitioner at our Legacy House. He is also a veteran, decorated veteran serving in the Afghanistan War. He's a Purple Heart recipient. And yes, he is a professional caregiver, but he is also keenly aware of the needs of the family, loved ones, and the caregivers. He is also surviving cancer, so recently he has been receiving care, and he has great wisdom to share. And you'll meet Diane Palmer. Generous and active in our community, she's a concerned citizen. She knows a lot about Parkinson's. She did not sign up for that role, but she has been widowed twice in her life, both times loved ones having Parkinson's, and she was very brave to come and share with us her pearls of wisdom learned, even though she is still on the grieving journey. Again, we're celebrating National Hospice Month. Thank you for joining our caregiver panel. Some of you are gathered here with us in person. We're limited attendance due to COVID, but many of you are visiting us online, and we will have a time for question and answers afterwards. Thank you so much. Diane, thank you so much for joining our caregiver panel and helping us celebrate National Hospice Month this November. I know you've lost your husband earlier this year, so I'm particularly grateful, but also interested in any takeaways you might have about caregiving, particularly interested in any takeaways or pearls of wisdom you might have discovered as you've been through this caregiving experience.
I would definitely, the first thing that pops to mind is the need for patience and more patience, because you'll always think you're a patient person, but under these circumstances, you need to refresh it every day. Have a little mantra that you say to yourself, something like, I can do this, I can do this. Or it would say, don't borrow trouble, don't borrow trouble.
I remember you telling me that he had a remarkably positive experience.
Oh, but he was pathologically optimistic about life on every plateau where he was. I was very blessed, and I feel that I think that the love you bring will encourage this development of patience, because you know you have to.
And you told me it was kind of contagious, like your attitude.
Attitude is the second most important thing, to stay cheerful and not in any way let your loved one know that this is a burden in any way on you, because it's if you emotions are very, very contagious. These, I mean, you couldn't be around Whit without, even when he was sick, or you you could also, you need to find time for yourself, obviously. That doesn't even need to be said. But you need to find ways to find time for yourself.
Now, I know you love reading. We've talked about this before, and I marveled at when did you find time to read?
Well, Whit loved television, and it was just a great joy for him, and not for me, because when I read, I had to have it quiet. So I got earphones that completely blocked out the TV. I could still be in the room and be with him.
So
and if
you are a creative problem solver.
Well, it was called a lifesaver for me, maybe. But I think that the days will seem much longer than 12 hours. They call it the 36-hour day, and I believe that to be true.
And that's the title of a book, isn't it? Is that one of the books
Yes.
you enjoyed?
Some of the books that I wrote them down here somewhere. One of my favorites was Passages in Caregiving by Gail Sheehy. And then a book by an attorney who represents people on death row. And it's called Things I've Learned from Dying, a book about life. Then there's one, Think Like a Monk, which was one of my favorites. I think the quote that I got from that was that we should plant trees under whose shade we did not plan to sit, and it kind of grabbed me, and it made me want to read the whole book. But it's a book about finding peace and relieving stress. I was very lucky to have help and wonderful, wonderful bonus children that came with the marriage. They were wonderful.
And you and Whit had lost one of his sons the year prior to his disease accelerating.
I just cannot tell you how, before hospice, you're kind of like this, and then when hospice comes, you're...
Well, that is good news.
It's an amazing transformation in feeling so incredibly responsible every single minute.
So it sounds like some resources and self-care to help you be positive and have this patience. Obviously was reading. Any other things that filled your soul? You told me about family being engaged. That's very positive.
Again, attitude. Just smile. If you can find humor. Whit used to love a funny movie with Peter Sellers in it. I can't remember what it was, but if you could bring humor and cheerfulness to it will be a boomerang effect.
Right.
It will, you help him, and him laughing helps you.
A game of catch.
Right.
Give and take. And you said that you have a quote about laughter that you like a lot.
The quote is, "Laughter is carbonated holiness."
That's right.
There's something a little sacred. Your soul is very bare when you're a caregiver, and I think I can only speak from. Well, I was a 40-year-old caregiver too, with a first husband who had end-stage Parkinson's and was blind.
So you had been through this before.
I had, on a very different level, because I was young, and I hadn't read as much then, obviously. But
they didn't have soundproof earphones then.
They did not. No internet. No. But you have to take, and your person that you're loving and taking care of will be very concerned for your well-being.
I remember you telling me that there's amazing guilt if somehow you give them a window into your discomfort or your exhaustion, that the guilt that comes from that is almost overbearing.
Yeah, it can be. And you need to understand and keep patting yourself on the back for getting through another day, for not having any emergencies or falling out of bed, or and that's another thing. You don't want to try to lift up a 200-pound man when he falls out of bed.
You need to know how to ask for help.
Right, absolutely.
And you did know that. And I'm just going to guess that you had no idea how strong you were.
I will tell. I still stand in amazement after my experience as a 40-year-old. If someone had said, "You can do this," I would have said, you know, for 3 years, a blind man that could not see. But again, when hospice came in, it's almost a miraculous change that goes through you from relief, and it lifts you up.
Oh.
Lifts you up.
Those are words we love to hear.
Yeah.
I have always thought at end of life, and the capacity, the invitation, the opportunity to give at that time is a sacred time. And it seems to me that you had that experience as well.
I did, and I had, as I said, a husband who was always worried about me. And again, I overcame that by being cheerful and optimistic and bringing laughter when I could and bringing friends in. We used to have football, it was a big football fan. So I would invite.
They have a lot of football games on TV, don't they?
Yeah. Oh, we became the football house. We used to go to the games years and years ago. But surrounding him with friends and family, obviously, I think that even if you don't feel like smiling, smile.
Okay.
It's amazing the reactions you'll get.
And you mentioned how well the family worked together. I'm guessing you'd done a lot of advanced planning, the advanced directives, everyone knew.
That was all. Well, I think, you know, when you're approaching 90, we knew we had to get everything.
But he did.
Yeah, he did.
And that's a gift.
And I think he did too, and you're bound to feel this way at sometimes, extraordinarily frustrated. I don't know that depressed is the right word, but if the caregiver feels depression coming on, they need to seek out some medical help.
Yeah.
And
so I'm going to try to summarize. You've been great. You've been so great, but I'm just going to try to summarize. So help me. You talked about attitude, being positive, patience.
Patience.
And it needs to be cultivated. And how attitudes are contagious. Laughter is carbonated holiness. And the importance of asking for help, receiving care, and just recognizing this is a sacred time. Does that sum up everything?
And I think that anytime you can bring in anything that will create laughter, there's something almost...
Search for it.
Yeah. And it's uplifting to the patient, and it makes you, the caregiver, feel good.
And creative problem solving.
But yeah, creative problem solving, and also recognizing that it's very important to know this is going to be a very difficult job.
And you have no idea how strong you are.
Right.
Okay.
You can, and when it's over, you stand back, and I mean, I know I did, and thought, I did a pretty darn good job.
I'd have to agree.
Yeah.
Thank you so much,
You're
Diane.
welcome,
Thank
Jessica.
You. Thank you, Dr. Lasada. You spend so much time with our families. Thank you for being on our caregiver panel today. And as you spend time with our families, I'm sure you observe them working together. And what advice, the number one advice, or the top couple of things you want to give to families as they try to meet the needs of their loved ones, our patients?
Well, the role of a caregiver, mostly if a person is in their terminal illness, in the later stages of the terminal illness, is a very difficult role, very demanding, and is demanding for many, many reasons. Probably the most demanding portion of being a caregiver is the self-request for being perfect. I usually use the quote of, we don't have to aim perfection, we should be aiming excellence. And in the same way that in Hospice of Marion County, we aim to that excellence in the compassionate care for our patients, I try to stress that with the caregivers as well. A caregiver role is a 24-hour job, 7 days a week, and it has not only the physical portion of that, it also has the emotional portion of that, the financial portion of that. So one of my biggest advices to the caregiver is to give themselves time
Okay.
to learn what we are demanding from them, because everybody that will go into the situation will be demanding something from the caregiver. To care for themselves, things as basic as being able to eat well, sleep well, take their own medications, attend their own physician's appointment, because at the end, if they are not in good condition, they cannot provide the care that the person is requiring. So it's going to be requiring that self-care first to be able to care for the patient. And asking for help is not to be ashamed of. We all have to be aware that we are, at some point, we're going to ask for a question we don't know an answer for, in assistance to move the patient, how to learn how to do the patient. And that's why it's so important to get the palliative medicine and the hospice team to assist during the process, because that's what we are trained for. That's what we are aiming for, and that's what we love to do. Bringing the care of the patient early on will assist the caregiver to not only survive their role, but also doing with pleasure, with honor, and with the fulfillment of that role as well.
Thank you. That's a lot. I'm taking notes so we can summarize and remember it. Great information. I know you have seen it all, and I know there are challenging situations which you've just described, but there's really been challenging families. And what resources have you relied upon or referred to for these really, really challenging, traumatic, difficult scenarios? Just if you can look back over your history of caring.
I think even though we are in a relatively small community, we have plenty of resources that are available for our families to provide the care that is required. And we have plenty availability to those resources. I usually talk about the Department of Children and Families as a non-punitive entity that can help us to provide the care that the person is requiring in the place of residence, because we have found out that most of us want to stay home. So calling DCF should not be seen as punishment or as a legal factor, because the Department of Children and Family may be the open door for those resources that are in the community that may be not as obvious to us, but they have much easier access. The Veterans Affairs Department has a multitude of resources that also are available for our veterans patients, and we have an excellent relationship with the VA to bring those services into the play of caring for the patient, not only for the patient, also for the caregiver. Just the fact that somebody is there to give you a break during the middle of the day, so the caregiver can go to the bank, can go to the doctor, may be of a huge assistance for them, and they will know that their loved one is well cared while they are taking care of their own errands. We have senior services who have a very close relationship with us in town. They provide housekeeping care at home. They will help the person to get Meals on Wheels. They provide companionship. They are like a link between the hospice team and themselves, with the goal of keeping the patient as long as possible at home, because that's the wishes.
Great resources, thanks. I also know you do a lot of teaching in the community, and you've really tried to educate them what it looks like to die, the physical symptoms to watch for, as well as the importance of planning ahead. And how does that affect a caregiver's ability to care for their loved one?
It takes time and training to get comfortable with the conversation. It's never easy to pull a Band-Aid. It's going to hurt. And the fact that I tell you it's going to hurt doesn't help you, because it's still going to hurt. But if I am empathic enough to be in the other person's role, to understand what their anxieties are, to understand what the pain is about, I can bring into that conversation, anybody, the patient, the caregiver, anybody that's involved in the situation, because at the end, they have questions. And they may be more afraid of asking the questions than of the answer to those questions. If the person is being given an opportunity to open up, to have the conversation at the level of comfort, they will do. They will be at certain point, they will do it. So we have to learn that that conversation should take place at a specific time in given circumstances. It's not before, it's not after, it's not in the driveway, it's not not necessarily at the bedside. So we have to learn where the person is to start a conversation. And it's not just one conversation.
Right.
It may take several attempts and several steps to get to fulfill all the information. What we have found out is by the time patients come to us, we may be the only person, the only part of the health team that has taken time, that has pulled a chair and sit with the patient or the caregiver to answer questions. And we may be able to answer questions from where is the biopsy result all the way to what I'm going to do with the house when he dies. And that is time that is needed, and questions that are going to be require our answer.
And plays out in the care. I mean, it's all part of
Absolutely.
it. I've heard you talk about your magic wand, that you want your magic wand to solve all problems. You know, what would your magic wand give for our caregivers?
Whatever the need at that time is when we are caring for somebody, and doctors are caregivers as well, in the sense that we take care of the patient and the nurse taking care of the patient and the social worker and the chaplain. When we feel that we cannot fix all the problems, we may also as well feel hopeless to the fact that we have done everything and nothing has worked. I usually ask the patient, what else can I do for them? And it be as simple as fluffing their pillow and walk out of the room or bring in a glass of water. So that magic wand is going to be depending on the patient's needs, the caregiver needs at that specific time. There's an anecdote on the cardiovascular surgeon who developed the mechanical heart first. He was in his 90s and still doing rounds in the hospital with the cardiology team, and he's talking about the fact that he was the creator of this machine that brought life to so many people, but he felt that he was doing more to the patients when the team will leave the room and he will come back to the patients and say, what can I do? And the request for the patient is, please fix my pillow, please fix my blanket. I cannot reach my my feet, that they're hurting. That was more fulfilling for him at that time than creating a mechanical heart when he was earlier on. So the most simple, most basic need, my magic wand will go for it.
And really, I love what you've said, the most simple needs can make the biggest difference in a person's life, but really you've asked and listened. And I think that's at the core of all of our care, is listening and asking, because a lot of people never get asked. And that is a wonderful opportunity to give. You've given us great information. Help me remember everything, just in summary. You've talked about the importance of self-care for the caregiver, and for them to be able to ask for help and to give up that top goal of perfection, that excellence in catching a lower branch on the way down is okay. And you talked about all the resources we use. Collaboration is so powerful, and working with senior services, the VA, the Department of Children and Families, and again, asking for help. And then you talked about the magic wand is asking and listening, even for the simplest of things like a glass of water or changing the blanket. Did I leave anything out?
Well, we are here in the community to help. So if there's any need, we have an excellent palliative care team seeing patients as consultants, wherever the patient is at. And we have the most excellent team caring and loving with the hospice team that can help to fulfill those requests for the patients when they are in the terminal stages.
And driving everything is education. Teaching people that love life in the middle of their lives to plan ahead, because it'll go so much better to feel better, live better. So
Absolutely.
Thank you for your time
Thank
today.
you
and
for
every
having
day.
me.
Bye-bye. Again, we've been having a caregiver panel, and I am so happy, honored, pleased to introduce you to Senator Dennis Baxley, who I introduced earlier as we began the program. But thank you so much, Senator Baxley, for helping us with our job of caregiving. As you know, it's at the core of what we do, and we see families struggle with it. So, of course, we wanted to bring in the best of the best and help them share their pearls of wisdom. So, I know you're a supporter of families. I've read about you. Of course, you've told me years ago, I don't even know if you remember, we were talking, and you said there's not a single problem that couldn't be solved by the family. So I've kept that in my mind as I've worked through this all these years. And, you know, how does your work personally, professionally, support families? Any legislation you can keep us abreast about how we might support you as you support us? Thoughts?
Well, it's a common bond that I have with hospice, and that is we take care of people, we serve people, and the family is the core of how to do that, and it's our model. But as you know, we have a lot of family brokenness, we have a lot of barriers to sometimes letting that work, and government can frequently be overambitious in trying to fill all those needs that we're not that capable with. So my view of the proper role of government is to support those policies that will strengthen the initiatives at the local level and at families particularly. And so we're always looking for ways to strengthen that bond and empower people to meet the needs of individuals in their own community. The exciting part for hospice is it's really been, over the development of the hospice movement, the model for making the system move around the patient. And patient-centered care is the key, and then inventorying what are the resources for this patient and how do we best move the system around them.
And you're right, the trends changed. I mean, in the 80s and 90s, families wanted their loved one to go to a hospice house. And now I think 72% of our clients want to stay at home.
Well, that's what we find in every area, particularly with senior adults, is their biggest concern is losing control of their own personal lives, losing their independence, losing their ability to drive, and being in a dependent posture to institutions. And so I have 50 years in funeral service. I started for work for Mr. Hires back in 1970, and who knew where all that would grow.
Well, and you honed your caregiving skills early.
You do, because you learn to get up and go when people need you and respond to that and assist families in taking care of each other. So there are common roots, common bonds. I go back to the day when we were the source for hospital beds and take them to the home. We had some period of my early experience in funeral service. We were the providers of ambulance service. And so all those are great
The county
places.
would love for you to take that over again.
Yeah, we didn't have the kind of subsidy. Matter of fact, we were operating on our own, but that's how a lot of things got started in small rural communities of Florida, and our history is very close to us. Most of what's happened has happened in the last 100 years in Florida in terms of modern development, but there's still a place for going back to those core values of helping people take care of each other and being the facilitator rather than the provider of everything. And
That sounds great.
That is a good economic model, but more importantly, it's a good human model of how we should be relating and caring for one another. So in addition to that, Jeanette and I have been married 48 years.
Congratulations.
We've had a wonderful adventure together. We have 5 children, 2 who were adopted foster children, and Jeffrey is blind and brain damaged from being a shaken baby. He came to us at 8 months. So we've had 30 years of learning how to relate and learn from him and how to maximize his opportunities in life.
What have you learned most from Jeffrey?
I think Jeffrey taught me in a very real way that everybody matters. Every single person matters and has potentials. And he has absolutely amazed me. I've been able to touch some very interesting things in business life and in public life, but I will tell you, nothing is more important than helping Jeanette raise Jeffrey and Renee, because they truly did not have a chance in life. He was a tiny little, looked like a 3-month-old when he was an 8-month-old. And in how many societies do we reach out and care? What potential does Jeffrey have for giving to society? And yet he's proved that everyone matters. And he grew tremendously, and we did too. I don't think it was all pretty, but we got it done. And
You've told me, or I've heard, that you were asked to help serve on an elder care bill, and it's slowly gaining support. And can you share, how does that affect caregiving and the public and their educational goals of learning how to be, to get those resources so that they'll know how to access support?
well, what we find is that people that will do a tremendous amount on their own with some supports. And if we can enable them to successfully carry that out, it's a good financial model for the state, but it's also the best model for the individual that needs that support. And that they actually support other people in the family. That's what you forget, is they're a huge emotional definition of the entire family. What we're trying to do with this bill is clear up definitions of who does what. We live in a time when everybody's in everybody's business.
Right.
And as we have an aging population, we see the numbers expand and the service potentials expand. So anybody that's in the business of delivering these services, they're all getting into different pieces of this.
And they all want one of the pots of money, those pots
That's
of
right.
Medicare money.
They're following that stream of activity and the resources that flow towards it.
Okay.
So
Sounds very complex.
I think what will happen is we'll be able to bring some clarity about who does what and make a real space for those people delivering elder care.
We will look forward to supporting you in any way that we can.
It is a process.
I prepared for this. I did some reading. Your staff has been great. Debbie was great in setting this up. But I was so happy to read that you're well known for your compassion on both sides of the aisle, and that's what motivates you. And so with that as a standard going before you, I just hope that everything goes really well for you, especially with this elder care bill.
Well, I think a lot of it stems from the awareness that our temporariness should increase our value and appreciation for each day that's a gift. It's not an entitlement. And that will help us use it more constructively, and that we can disagree strongly about the how-tos of policy world. It is a place where everybody gets together and have their say, and so you're going to conflict. But that doesn't mean you have an excuse not to love and take care of each other. And that is something I've tried to convey in the setting that I'm in.
Thank you so much. Thank you for your time today. I'm glad you're in Ocala. David, thank you so much for participating in our caregiver panel and helping us celebrate National Hospice Month. You've been through this every year. And I particularly am grateful that you're able to come today because you've always been a caregiver, a healthcare provider, and so ready to meet the needs of our clients and patients at the Legacy House. But now you're battling a disease as well, so you have been receiving care. And I'm interested, and everyone is, about the differences you've noticed or what's changed as you've slightly shifted roles.
Honestly, not over much. You know, I've said for years, even before coming to hospice and when I worked in the emergency department, that sooner or later everybody ends up on the wrong side of the needle. It's given me kind of a perspective that sooner or later, it's going to be me in the bed. It's going to be my wife in the bed. It's going to be my sons, my kids, my parents in that same situation. You know, my wife is a physician assistant as well, and we talk about this. We've always tried to treat our patients the same way that we wanted to be treated. I was very lucky. When I went to the ER with belly pain, the doc taking care of me was a friend of mine. Which is part of the reason why I choose to live and work in this same community.
You know the drill.
Right. Well, it's a difference taking care of people when you see them at Publix too. And when I got admitted, my wife knew all of the doctors that were there taking care of me and some of the nurses that were taking care of me. So I did have exceptional care. It's not and hadn't been my first time looking at a possible demise. I wasn't overly scared about it.
No fear.
Well, some, but it's a big difference when you're looking at it at 21 years old at the barrel of a gun as you are at 48 looking down a nasty tumor and getting splayed open like a gutted fish. So it was a little bit different. I think the idea that came is that it's going to be okay, even if it's not.
Come what may.
Yeah, what can I control? What can I not control? I had no control over the fact that it was in there. I only had control over what I choose to do about it.
Do you find yourself wishing you could pass on that spirit of come what may to many people that you're taking care of?
Oh, and their families. And their families, which is probably a little bit harder. It was definitely harder for the kids and for Edis than it was for me. You know, I remember talking to the pharmacist. The oncologist had a specific pharmacy where I got the chemo from. And the pharmacist called every one of the patients when you started it to make sure that you didn't have any interactions or knew what the side effects were. And I talked with him for about half an hour, and at the end he's like, I haven't had this experience before. I said, what? He said, you're fine. And he's like, you're okay with this. I'm giving you chemotherapy. And you're like, okay, well, let's just go ahead.
It must have been a good feeling.
So he was flabbergasted, and I'm like, okay, we'll just send
This is who I am.
So I wasn't overly worried. Now, my wife and kids, yeah, they were a little bit different. They were far more concerned, far more anxious. If I could have passed that piece off to them, I think I probably would have taken some of that. And I still see that with some patients that I see, you know, when I see patients at Legacy House and their families every day. Oftentimes the patient is better than the family is.
What is the first and foremost thing you wish all caregivers knew, or that you could give to caregivers in a bottle?
Know your place.
And maybe you just said it.
And I don't say it, and that's really it, know your place. And I don't mean that in a derogatory term. I mean, know what you can control and what you can't. Choose to spend the energy worrying and working about those things that you have control over. The rest, there's nothing that you can do about.
It's beautiful. It really is.
I don't.
We got to figure out how to teach that to everybody.
I don't mean it to be hard. I don't mean it to be upsetting.
No.
I don't mean it to be in a way of you know, stay out of my way. Let me do what I need to do. I mean it to be helpful. I mean it to be just keep it in a direction of what you can control.
And it will work towards healing.
That's it, because you have, I mean, people with cancer and bad heart and everything else, and they come to me, and by that time it's in a horrible state and condition, and there's nothing you can do about that. What can we work on from here?
Are there any takeaway experiences that you can share with other caregivers? I mean, you've been sharing that these last few minutes, thank you, but any resources that are important to you and your family, or just memories that just stick out in your head as you have been a healthcare provider working with families and caregivers?
Well, I've been a healthcare provider, I've been a recipient of healthcare, I've been a family member of a patient on hospice just relatively recently. The hardest part for families coming in, I think, really is that you're overwhelmed with information.
Okay.
Take it piece by piece, one step at a time. The resources, in particular, the ones that we help to provide with, we will hold your hand and walk you through every step of the way. You know, from my part before going to school, and my time in the military, and I do tell family members this part often, you know, movies like The Green Zone irritate me because it's just so not true. Nobody goes outside the wire alone. Anything great that was ever done was done with a team. You have a team, use it.
There's a lot of joy in collaboration.
So,
and so much power.
and a lot less stress. A lot less stress. Things always turn out better. This is, for family members, this is going to be one of the hardest things you'll ever do, is to have a loved one here. Almost as hard as being in it yourself.
I've heard that.
Let us help.
A friend of mine was married to a man who had a kidney transplant, and she said there's not a physician or a nurse imaginable that understands what the caregiver goes through. So that it's almost more stressful than the actual patient, which is what you've just said about your wife and children. Your words are beautiful. I'm so glad we have them on film for this virtual panel. And again, just thank you so much. Is there anything else you'd like to say?
No, you know, I've been, like I said, I've been all three. There's a point in time where family just counts to be family. It is hard being that caregiver. For those of the patients who need to come to Legacy, Brandley, or Estelle's house, don't see it as a failure. For the most part, you've done everything that you could. While you're there, let us help. Be their daughter, be their son, be their wife, their husband. They need that. It's a crucial part of their care and their comfort. Don't discount that.
And let the professionals do the rest of the work.
It's a team effort.
Yeah.
It's a team effort. Everybody has part of that, is part of that team. Family members are no less important than anybody else.
I love the expression, there's healing and wholeness even in the absence of a cure. And you've been sharing that. Thank you again so much. And I know it goes without saying that everyone on the hospice team is so proud to have you standing shoulder to shoulder with us. Thank you.
Thank you, Judy. Thanks.
Okay.
Thanks for having me.
Okay, great.